Jari. He is a 45-year-old, recreationally active man who attends regular step classes. 6 months ago, Jari was diagnosed with midportion Achilles tendinopathy. He has tried conservative physiotherapy treatment, but his pain persists. Pop quiz. Pull out a piece of paper and answer the following. For Jari, what is the best treatment option with the highest level of evidence out of surgery, sclerotherapy, eccentric loading, and shockwave therapy? Learning objectives. By the end of this video, you will be able to list the 4 treatment options for midportion Achilles tendinopathy and identify the best treatment option for the patient presented based on research that has a high quality of evidence. Now back to Jari. Jari, being frustrated that he could no longer keep up in step class, decides to investigate his treatment options.
Eccentric loading of the calf muscle has been shown to improve Achilles tendinopathy, although the mechanism is still unclear. The patient stands on a step with the ankle fully plantar flexed and all their weight on the injured leg, and loads the calf muscle by dorsiflexing the ankle. Shockwave therapy sends a low-energy shock wave to the injured area to stimulate soft tissue healing and inhibit pain receptors. A randomized controlled trial compared eccentric loading to shockwave therapy to a control group. 25 participants were randomly assigned to each group. The researchers were blinded to the treatment, however, the participants were fully aware of their treatment. Participants in the study had Achilles tendinopathy for more than 6 months and had unsuccessfully tried conservative treatments. After 4 months of treatment, both the eccentric loading and shockwave therapy group showed a significant decrease in pain when compared to the control group. A follow-up randomized controlled trial used a similar study design and group of participants, but compared eccentric loading to a combination of eccentric loading and shockwave therapy. 34 participants were assigned to each group. The results supported a combination of eccentric loading and shockwave therapy as the most effective treatment option.
Sclerotherapy treatments target neovessels, the abnormal blood vessels associated with tendinopathy. Sclerosing agents reduce neovessels by creating fibrosis within a blood vessel, causing it to close and be replaced by other types of tissue. One downfall is that sclerosing agents may also affect neighboring nerves. A randomized control trial tested the effectiveness of sclerotherapy in reducing the chronic pain of Achilles tendinopathy. This was done by comparing injections of a sclerosing agent with a temporary anesthetic. The study had 20 participants, all with long-term midportion Achilles tendinopathy. The study was conducted in a double-blind fashion. Results were based on pain level during Achilles tendon loading activity. They also used Doppler ultrasound to investigate if there was a visible difference in the number of neovessels. After 2 treatments, 0 out of 10 participants in the control group were satisfied with their treatment. In the treatment group, injected with the sclerosing agent, 5 out of 10 participants were satisfied with their results. Post-trial, all control group participants accepted injections of the sclerosing agent, resulting in 9 out of 10 being satisfied. The 5 unsatisfied participants from the treatment group also accepted additional injections, resulting in 5 out of 5 being satisfied. Sclerotherapy treatments were found effective in treating pain of mid-portion Achilles tendinopathy by eliminating neovessels. These results are especially promising for Jari, since the participants involved are similar to him, being of like age and having long-term mid-portion Achilles tendinopathy.
Surgical treatment is often used after other treatment options have failed. Multiple procedures have been used in treating Achilles tendinopathy. Although surgery has been found to have positive results, evidence is lacking. A critical review of 26 studies looked at their overall outcome and quality. The review found major deficiencies in the studies. None were randomized control trials, and many were found to be biased or missing important information. Studies of higher quality are needed.
Class activity. Turn to the person beside you and make up an acronym to remember the 4 treatment options for mid-portion Achilles tendinopathy. Here is our sample acronym. Every stepper stumbles sometimes. Post quiz. Based on the evidence provided, what do you think is the best treatment option for Jari? Discuss this with the person next to you. Based on the evidence provided, Jari has decided on a treatment plan. First, he will undergo eccentric loading combined with shockwave therapy. If this treatment is unsuccessful, he will follow up with sclerotherapy. If sclerotherapy is ineffective, he will resort to surgery.